In this video, the topics covered is body mass index calculations, drug dosage calculations, IV flow rate calculations, drip rate calculations, pediatric dosage, mean arterial pressure, fluid intake and output balance, temperature conversion, cardiac output calculations, Naegele's rule, weight-based medication dosage, clinical nursing mathematics. Let's start. Question number 1. A patient weighs 70 kg and has a height of 1.75 meter. What is the body mass index? The right answer is option B, 22.9 kg per meter square. So here is the equation for that. Body mass index is equal to weight in kg, the whole divided by height in square, height in meter square. So here the weight is 80 and height is 1.6 meter. So we get the answer 31.25 kg per meter square. Moving into the next question. Question number 2. Doctor orders 750 mg medication. Available strength is 250 mg per tablet. How many tablets should be administered? The right answer is option C, 3 tablets. Rationale, dose to give is equal to desired dose divided by available dose into quantity. So here the desired dose is 750 and the available dose is 250 and the quantity is 1. 3 tablets is the right answer. Question number 3. 1500 ml IV fluid is to be infused over 12 hours. What is the flow rate? The right answer is option C, 125 ml per hour. The equation is flow rate is equal to volume divided by time. So here volume is 1500 and the time is 12. So the right answer is 125 ml per hour. Question number 4. BP is 150 by 90 mmHg. Calculate the mean arterial pressure or MAP. The right answer is option B, 110 mmHg. The equation is mean arterial pressure or MAP is equal to systolic BP plus 2 into diastolic BP, the whole divided by 3. So here systolic BP is 150 and diastolic BP is 180. Diastolic BP is 90. So by this equation we will get the answer 110 mmHg. Question number 5. Child weighs 30 kg. Prescribed dose is 50 mg per kg per day. Answer is 450 mg. So here is the equation. Dose equal to mg per kg into weight. So mg per kg here is 15 and the weight is 30. So the prescribed dose is 450 mg per day. Question number 6. Convert 104 degree Fahrenheit to Celsius. The right answer is option C, 40 degrees Celsius. Here is the equation. Degree centigrade is equal to degree Fahrenheit minus 32 into 5 by 9. So here the temperature in degree Fahrenheit is 104. By this we get the right answer 40 degrees Celsius. Question number 7. Intake is equal to 2200 ml and output is 1800 ml. Fluid balance is. Right answer is option B, 400 ml. Fluid balance is equal to intake minus output. So here the intake is 2200 ml and the output is 1800 ml. By this we get the right answer 400 ml plus. 8. Question number 8. Adult dose is 400 mg. Child is 8 years old. Using Young's rule, calculate the dose. The right answer is 160 mg. Equation is child dose is equal to age divided by age plus 12 into adult dose. So here the age is 8 and the adult dose is 400. By this equation we get the right answer 160 mg. Question number 9. 600 ml IV fluid is infused over 4 hours using a microdrip set 60 GTT per ml. Calculate the drops per minute. The right answer is option C, 150 GTT per minute. Rationally, drip rate is equal to volume into drop factor, the whole divided by time in minute. So here the volume is 600 and the drop factor is 60 and time is 240. By this we get the right answer 150 GTT per minute. Moving into the next question, question number 10. LMP is equal to 15 March 2025. Calculate the EDD using Naegele's rule. So here the right answer is option B. Rationale is EDD is equal to LMP plus 7 days minus 3 months plus 1 year. Okay, by this we get the right answer 22 December. Question number 11. A patient receives 2 liter IV fluid over 16 hours. What is the hourly flow rate? The right answer is option C, 125 ml per hour. Flow rate is equal to volume divided by time. So here volume is 2000 and the time is 16. By this we get the right answer 125 ml per hour. Question number 12. A child weighs 22 kg. Prescribed dosage 12 mg per kg per day. Calculate total daily dose. The right answer is option C, 264 mg. Dose is equal to 12 into 22 is equal to 264 mg per day. Question number 13. BP is 90 by 60 mmHg. Calculate the MAP. The right answer is option B, 70 mmHg. MAP is equal to SBP plus 2 into diastolic BP the whole divided by 3. So by this equation we get the right answer 70 mmHg. Moving into the next question. Convert 39 degrees Celsius into Fahrenheit. The right answer is option C, 102.2 degree Fahrenheit. The equation is degree Fahrenheit is equal to 9 by 5 degrees Celsius plus 32. By this equation, We get the right answer 102.2 degree Fahrenheit. Adult dose is 500 mg, child weight 75 lb. Using Clark's rule, calculate the child dose. The right answer is option C 250 mg. Child dose is equal to weight in lb divided by 150 into adult dose. By this equation, we get the right answer 250 mg. Moving into the next question, question number 16. A patient has intake 3200 ml and output 2600 ml. What is the fluid balance? Right answer is option C plus 600 ml. The difference of intake and output, we get the 600 ml, the right answer. Question number 17. Infuse 500 ml over 5 hours using a macro drip set of 15 GTT per ml. Calculate the drops per minute. The right answer is option B 25 GTT per minute. Here is the equation 500 into 15 the whole divided by 300 is equal to 25 GTT per minute. Question number 18. A woman reports LMP on 20 June 2025. What is the EDD? The right answer is option C 27 March 2026. EDD is equal to LMP plus 7 days minus 3 months plus 1 year. Question number 19. A medication order is 1.5 gram. Available stock is 500 mg per tablet. How many tablets are needed? Right answer is option C 3. Question number 20. BMI of a person weighing 72 kg with height 1.8 meter is. The right answer is 22.2. BMI is equal to weight divided by height in meter square. We get the right answer by this 22.2 kg per meter square. Question number 21. Cardiac output is equal to heart rate into stroke volume. If heart rate is equal to 80 per minute and stroke volume is 70 ml, what is the cardiac output? The right answer is option C 5.6 liter per minute. The equation is 80 into 70 is equal to 5600 ml per minute and in liter 5.6 liter per minute. Question number 22. A child is 4 years old. Adult dose is 300 mg. Using Young's rule, what is the right answer? The right answer is 75 mg. Question number 23. A patient receives 1800 ml over 12 hours. Flow rate is. The right answer is option C 150 ml per hour. Rationally, 1800 divided by 12 is 150 ml per hour. Question number 24. Convert 95 degree Fahrenheit to Celsius. The right answer is option B 35 degrees Celsius. 95 minus 32 into 5 by 9. By this equation, we get the right answer, 35 degrees Celsius. Question number 25. BP is 180 by 100 mm Hg and MAP is what? The right answer is option B, 126.7 mm Hg. Rationale, 180 plus 200 divided by 3. By this, we get the right answer, 126.7 mm Hg.